We're interrupting programming right now to bring you breaking news. Mayor de Blasio is holding a press conference to provide the latest information on the city's ongoing outbreak of the novel coronavirus. Let's listen in.
Here through our public health agencies, and we're constantly assessing what we're experiencing here in New York City. This is, again, another reason to appreciate the work of our disease detectives at Department of Health, who are not only working on specific cases and helping to address the specific individuals, but they're also gathering a huge amount of new information. This is basically research that's happening right here in New York City, giving us direct knowledge of how this disease is acting so that we can make the best strategic judgments. There is a lot of information out there in the global health community, national health community, but everyone understands there's still a lot that is not understood about this disease. Again, this is a disease that at this moment does not have a cure, does not have a vaccine. So the fact is that the ability to constantly gather new information and understand the way the disease acts in real-world conditions is crucial. We talked about this yesterday. There's a real difference between real-world conditions and a laboratory. So we are getting more and more information, and it is affecting our understanding and therefore our strategies. You'll hear those updates as we go along. Also want to emphasize this, of course, is an ever-changing situation. There are times we get guidance from the World Health Organization, from the CDC, State Health Department, obviously our own health officials. Sometimes there are areas where there is not clear guidance or there's different guidance, different levels of government. We're constantly assessing, refining. So this is an ever-changing situation. We will update you constantly. You will see variations. We'll try and identify those variations and why they're happening, but you should expect it. You should expect changes in information, changes in approach as we go along. Therefore, the things we say in many cases are preliminary because the information about the disease is preliminary. We hope over time to get a much deeper understanding. But we can say some things with, a high level of certainty based on actual experience so far. And I'm going to repeat today and probably several other times in coming days what we understand about what is called transmissibility, which is literally the process through which the disease goes from one person to another. Because there's still a lot of misunderstanding out there and a lot of mythology out there. So I'm going to put it, again, in very plain graphic terms, because I think New Yorkers, we are blunt and straightforward people. People want to hear the truth about this stuff. And the way I try to explain it is sort of what it is versus what it's not. So what it's not is a disease like some that hang in the air, for a prolonged period of time, that you can come into a room hours later after someone has been there with the disease and you have a danger of contracting the disease. That is not what we're talking about here. This is a disease that requires a very direct level of contact. The question of surfaces has come up a lot. The best understanding of our public health officials is that this is a disease that does not live long on a surface. Certainly on most surfaces like metal, plastic, a desk, a kitchen counter, a subway pole, it's only a matter of minutes before the disease dies, the virus dies in the open air. If it got on a part of the human body that's not the mouth, the nose, the eyes, might live a little bit longer, but still a very limited period of time. And the only way it can become active and affect you is if it gets into the mouth, the nose, the eyes. If the disease got on your leg but nowhere else, you don't get infected. We talked yesterday about if somehow someone sneezed over some soup they were serving you and then you drank the soup, you're not going to get infected. Same thing with a glass of water. It has to be direct fluid from one person right into you, which means a cough, a sneeze right at you, that you receive directly into your mouth, your nose, your eyes, or potentially onto your hand and then immediately onto your mouth, nose, eyes. A lot of us, and I am one of them, often touch our face. It's kind of a normal human reaction, normal human habit. You want to try to do that less nowadays, in addition to all the other precautions, the washing hands and the alcohol-based sanitizer. It's great to try and reduce that contact between your hand and your face. But if it doesn't get into those parts of your face, it doesn't get in. That's what we understand at this point. And when we talk about the close contact, we've seen this in cases. Again, we understand if someone sneezed right at you, if they coughed right at you, they did not do this like they're supposed to. You're supposed to cover your mouth when you cough or sneeze into your elbow. Someone just sneezed or coughed right at you. Yes, direct hit, that's a real problem. If you're deep in conversation with someone right up next to you and they're vehemently talking and some spit comes out and it gets right into you, that's a problem. It is not a problem if someone is 10 feet away and they sneeze. It's not going to reach all the way over to you. But if it's close to you, that's where the problem occurs, and that's what we want to be mindful of. So those are just basic points I want to say up front. The other thing I really want to emphasize, and I've been working with our health officials on this because there's been a lot of misunderstanding, and we really want to get right to people who's vulnerable and who's essentially not. Now, I'm going to say on this one, again, I'm the layman here. I've been talking to these public health officials now for days and days and days. I'm trying to composite the information, make it simple and clear for New Yorkers to use. I'll put an asterisk on and say there are always exceptional cases. So I'm not saying I'm giving you, a perfect rule that affects every single time, but this is the basic rule, overwhelmingly consistent rule based on what we have seen globally from this disease. So I want to start with who is most vulnerable. It's abundantly clear who is most vulnerable to contract coronavirus. It is people who have pre-existing serious conditions and are over the age of 50. And those pre-existing conditions, and our team has really been working to get this definition clear for everyone because we think it's helpful if it's very, very clear. So the pre-existing conditions in question are heart disease, lung disease, cancer, immune system vulnerability, and diabetes, thank you, and diabetes, those 5. I'll do it again. Heart disease, lung disease, cancer, compromised immune system, and diabetes, those 5 pre-existing conditions. And then one other thing we could call a factor is not a pre-existing condition, but it is a factor that we are concerned about and we've seen already. If you are a smoker or a vapor, that does make you more vulnerable. And we'll say it probably several times today and in the days to come. If you are a smoker or a vapor, this is a very good time to stop that habit, and we will help you. Our health department and our colleagues in the state have a lot they can offer people who want to quit smoking or want to quit vaping. If you can do that, if you want to do that, please do that now. It is a very good time to take that vulnerability off the table. Call 311 if you need help. So for folks who have one of those 5 pre-existing conditions, or God forbid more than one, even more, for folks who have that reality that they're a smoker or vapors, they're in particular danger. And if they're over 50, that is the category where we're seeing the biggest problems by far. That's where the real danger is. Those are the folks, God forbid anyone passes away, but overwhelmingly the folks in greatest danger, the folks we have the greatest concern about whether they will still be alive at the end of this is the folks who are in that category. Okay. The next category to think about is folks who have those pre-existing conditions but are under 50 years old. So the pre-existing condition is a deep concern at any age, but a much deeper concern if you're over 50 years old. The next category is a healthy person over 50. Now, a healthy person over 50 in most cases is going to do fine, but there is somewhat more vulnerability if you're over 50. And then the last category, thank God, is the biggest category of New Yorkers. Under 50 years old does not have one of those 5 pre-existing conditions or smoking and vaping. That's the single biggest category of people. And for those people, by and large, if you contract coronavirus, you're under 50, you don't have those pre-existing conditions, you will generally experience it the same way you do a common cold or flu, and it'll be unpleasant, but you'll be okay in the end. We see very consistently with children, again, this is not a perfect rule, but it has been a consistent reality. Children who do not have pre-existing conditions, their general experience, again, will be that of something like a common cold or flu. So I want to reassure parents on that point, but I also want to say to parents who do have children with those pre-existing conditions that we want you to be very vigilant. Make sure they do not come in contact with folks who have symptoms. And obviously, if any child who does have those symptoms develop, we want to be very careful to get them care right away. But I want to be clear about where there is some good news, and the good news is, for the vast majority of New Yorkers, they are in the less vulnerable categories. Okay. Let's go over numbers, but first, one other thing, there's going to be constant flow of information in lots of different forms for folks who want to get connected to information. You can text the word COVID, C-O-V-I-D, COVID, to 692-692, and you will get regular updates from the city. Let's go over numbers. As of yesterday, we had 12 positive cases since the beginning of this crisis. There is one new one, and I'm going to say up front, we are gathering information on this new case. We need a little more time to get all the facts 100% clear, so we'll have an update on the new case later on today. I can only tell you in New York City, in the Bronx, but I want to get all the facts straight before we give you more. So 12 as of yesterday, plus 1, 13 as of today. 7 new cases since Friday. Negative tests, we are now at 146 tests that have come back negative, and that is 60 new tests since yesterday. So we'll keep giving you those updates as long as we can. Now the numbers, I'll just finish it and say we also have 76 tests outstanding that we're waiting for results on that we'll know by the end of the day. I'll go over specific cases in a little bit. Our goal is to keep giving you the numbers and the case breakdowns as long as we can. There well could be a point where the number of cases gets so large that becomes impractical to be able to give you that level of detail. We'll keep giving you updates as much as possible. I think it's fair to say, you know, right now for a crisis that's been going on 6 weeks or more in this city, we're at 13 positive cases. I think we could well be at 100 cases or hundreds of cases over the next 2 or 3 weeks. We have to be prepared for that reality. So we're going to, today I'm going to give guidance and updates. But as we end up in a situation where there are more and more cases, again, we'll be able to give updates, but maybe not as fine-tuned in real time. It's also important to say that our public health apparatus is already planning on the assumption that we will be at hundreds of cases soon and is ready for that reality, and we'll talk about that as well. Fundamental change has occurred in the last few days. This was overwhelmingly, until this week, a problem related to travel. And there still are travel cases coming in. The last few days, last 24, 48 hours, several of those new cases. We have one that's related to travel to Italy, one related to travel to Chile, one related to travel to Egypt. So it's not that the travel issue is entirely over. But what is coming up now, unfortunately, is the community spread reality. And that's where you're going to see much greater numerical growth. There are things that we can do to address community spread. So I think the way to think about this is phase one was travel essentially, and there were very specific strategies we could use to address something that was being brought in by travel. We're going into phase two now where the dominant reality is community spread, and we're going to have instructions on how to deal with that. You'll get guidance today, and the guidance will be constantly updated. But finishing on travel, because it is still pertinent, we had canceled school trips to 5 affected countries. We are now taking the next step, and we're banning school international trips across the board out of abundance of caution. Also, for our city workforce, there will be no non-essential international travel at this point. We're going to put some other actions into place. Again, this is a lot of different pieces. They won't flow in perfect order, but bear with me. A lot of concern has been raised about our small businesses, many of which are really hurting right now and are seeing fewer customers. I'm going to just tell people, we're going to give you guidance every single day. We'll update it. I am still going out to small businesses. I am saying to my fellow New Yorkers, unless you have particular vulnerabilities or you have symptoms, I believe you can go about your life, continue to patronize our small businesses, and I urge you to. But we have to provide some relief for the businesses that are hurting right now. So we have 2 forms of relief we're going to implement right away. For businesses under 100 employees that can document a decrease in sales of up to 25%, they will be eligible for no-interest loans. And those loans will be up to the dollar figure of $75,000. So we will be able to get money in their hands to tide them over. The details of that initiative we'll put out. This is something that just got approved. We just finished the process on. We'll get you further details on it in the course of the day. For our smallest small businesses, under 5 employees, a lot of mom and pop stores, neighborhood-based stores, under 5 employees, we will offer grants of up to $6,000 to help them retain employees. That's a literal direct cash grant to very small stores at a point where they may have to lay someone off. We'll get some money in their hands as a grant to help them keep people employed. And any business under 5 employees that's suffering an immediate crisis because of what's going on can call 311 and they will get help getting that assistance. In the schools, again, emphasizing children in general at low risk, but children with those pre-existing conditions we are very vigilant about, want parents to be vigilant as well. We're going to add 85 nurses in the course of the week to ensure that every school building will have a nurse on call, on duty during the school day, remembering that some buildings have 1 school in them and some buildings have multiple schools in them. Every building will have a nurse, and that will be implemented in the course of the week. Continuing with the guidance we want to provide people, and remembering again that real clear, distinct difference, pre-existing conditions, especially above the age of 50. So the issue here is to think in terms of symptoms, and the particular concern would be if someone had fever plus either cough or shortness of breath. So we're going to keep providing more pinpoint information. If you have fever plus cough or shortness of breath, we are particularly concerned, and then much more concerned if that's accompanied by those pre-existing conditions. And again, our health commissioner will go into more detail. Crucial point, if you're not in a high-risk category, again, that biggest high-risk, the biggest category of people, low risk, biggest low-risk category, under 50, no pre-existing conditions, particularly for folks in that category. If you've got symptoms, first thing to do is to alert your healthcare professional. If your symptoms are moderate, you can stay home. If they improve, that says everything. If they don't improve, we want to get you in, we want to get you tested. There's been a lot of questions about public events. This is going to be a question we're going to ask ourselves every single day and update you every single day. Based on the information we have today, we are not altering our stance on public events, but we are making clear, people, I think it's straightforward and obvious, but it bears being said in a straightforward fashion. If you are sick, you shouldn't be going to a public event. If you are sick, you shouldn't be going to work. If you're sick, you shouldn't be going on the subway. Now, if you are not sick, but you're in that particularly vulnerable category, over 50 pre-existing conditions, you should avoid unnecessary public activity. There are some things someone may have to do, but you should avoid unnecessary public activity. We'll go over the basics every single time. The commissioner will say it again. Wash your hands. Use alcohol-based hand sanitizer. Dan Nigro is going to be my test model. Come forward with your elbow. Let me see your elbow. You can do this. Okay, do it again, Dan. That's our new handshake until further notice. And just be very aware of symptoms. Don't ignore them. Don't explain them away. We have a couple of things we want people to make adjustments on, and for some people and some employers, this will be something they can do readily. For others, more challenging. But this is guidance, and it's pretty much common sense guidance at this point. For employers, if you can institute commuting or more telecommuting, you should. So if you have the kind of work where telecommuting is a possibility, or if you're using it now and think you can use it more, we'd like to see you do that. See how much of that you can do, the more the better. Employers who can stagger their work times, that would be very helpful. Right now, at the height of rush hour, obviously people, we've all experienced it. We've all been the sardines in the subway. We're in super close proximity. We'd like to open that up a little more, and one of the good ways to do it is to stagger work hours. So any employer who is in the possibility of staggering work hours, that's helpful. If people typically come in at 9 a.m. and they can come in instead of 10 a.m., that helps. Or if you have different people that can come in at different hours a little more, that helps. And then everybody, of course, following the basic rule, if you're sick, stay home. If you become sick at work, get out of the workplace. If it's mild, go home. If it's more serious, get to health care. Remember, we have a paid sick leave law in this city that grants people 5 days annually. And as you'll hear from Dr. Barbot, typically the symptoms we're talking about here manifest and give us a clear sense of direction within 2 or 3 days. So the paid sick leave is there to give people the opportunity to be home in just these kinds of situations. If you are traveling by subway and the train that comes up is all packed and you can possibly wait for the next train in the hopes it might be less packed, please do. Very common sense measure, something a lot of us do anyway. If you have the option of walking to work or taking a bike to work, please do. Buses can be very crowded, probably pound for pound a little less crowded than a lot of subways. If a bus is a less crowded option and you can use that, please do. In terms of the guidance to healthcare providers, obviously we're making very clear that we are now in this next phase, this phase 2, which is where community spread will be where the vast majority of cases are coming from, not travel. Specific guidance is being given to providers to the max extent possible to have a healthcare professional meeting patients as they enter healthcare facilities, or just outside, I should say, the healthcare facility. The commissioner will clarify, to make sure that if they need a mask put on them, that happens, or they need to be handled in a particular fashion, that happens. In terms of the federal government, we've made multiple appeals, and I think, yes, here we go. This is the letter we've sent to the FDA. This is one of many communications we've sent to the federal government asking for help on testing. This relates to the issue of automated testing that would allow us to do not only hundreds, but potentially thousands of tests in a single day and get same-day results. Can't do it without FDA approval. We've asked for days now. We are awaiting that approval. We need that approval. It's one of the best things the federal government could do to help us. Everyone knows this has been a really persistent problem. The federal government has been slow and elusive on all questions of testing, but this is one where they could finally get it right. That FDA approval would make all the difference in the world for us. Also, we're putting out, and this kind of summarizes a lot of what I've said, we're putting out this simple flyer. You'll see it a lot. The basic rules that I've outlined here. We're going to be doing an advertising campaign to get the word out on this as well. Okay. I'm going to go through some numbers and some cases. The number of folks in mandatory isolation has gone up to 19. They get a daily call to check on them. They get unannounced visits in person twice a week. If they violate the standards of the quarantine, they will be fined, and they will find a police officer at their door on a regular basis, and that will either be NYPD or the Health Department police. Again, I'm saying that out of abundance of caution. I think overwhelmingly we are seeing people are honoring quarantine. They have, like everybody else, heard weeks and weeks of warnings about coronavirus. We don't find a lot of people taking quarantine lightly so far, thank God. The voluntary isolation number has gone down substantially, and that is related to the fact that we are getting fewer and fewer travel cases and people have gone through the full 14 days. But of course, that number will continue to change. You'll see fewer and fewer travel cases. You will start to see more community spread related cases. But as of today, in voluntary isolation, 2,176. They are now getting a regular communication pattern. In the beginning, they're provided information, including a robocall and a text on how to approach the quarantine and what to do if they develop symptoms. They get repeated texts and constant requests to know if their condition has changed, what to do if it does. If they need immediate assistance, we're going to be continuing to deepen that communication. We'll have more to say on that. A couple of updates on some other issues that come up. On schools, in addition to our traditional public schools, we have made clear to charter schools, religious schools, private schools, that if they need any additional cleaning supplies, they will be delivered tomorrow. And we have requests. And we have requests from 132 Catholic schools, 59 Jewish schools, and 1 charter organization. which means multiple schools. And those deliveries will be made tomorrow. In our traditional public schools, the mandate is abundantly clear and obvious. Every bathroom has to have soap and towels in abundance. Sinks have to be working. And school personnel will be held responsible for that being kept consistent. Officials of the DOE will be spot checking schools on a regular basis. We had one case that was particularly notable of price gouging. A hardware store known as Sheeman and Grant in MIDTOWN. They have been fined. What they did was unacceptable. We're using them as an example. The inspectors have been on site. The case has been referred to the Attorney General as well. Any price gouging, we want it reported immediately to 311 so we can act on it. Just saying to all store owners, absolutely unacceptable. Come on. This is a crisis. Help your fellow New Yorker. This is not a time to try and profit. And we'll be giving plenty of messages to people in different elements of the business community about how to be responsible at this moment. As I said, we have 7 new cases since Friday, one of which you will get the update on later, which is the Bronx case. The information we're providing you is what we have, and it always keeps evolving, so it's preliminary, but we'll give you updates as we get more. The family on the Upper West Side, the father had tested positive, age 51. This is a family that has a nexus to that cluster in Westchester County. Of the family members, the mom of the family and one daughter, the mom's 47, the daughter's 11, tested positive. None of them have pre-existing conditions to the best of our knowledge, the dad or the mom or the daughter. All have been symptomatic. All are doing well now. Isolated at home. 2 other daughters, ages 8 and 10, have tested negative. No other close contacts per the work of the disease detectives. We have, and again, we'll try and keep this in a little bit of numerical order. Those were cases 6 and 7 positive tests. Case 8, the Uber driver in Far Rockaway. 33-year-old man. He is an Uber driver. He is not a TLC Uber driver. He works in Long Island, so he's not under TLC jurisdiction. Had pneumonia related to coronavirus, now in stable condition at the hospital in Far Rockaway. Family has been contacted by the disease detectives. All family members in isolation, all family members asymptomatic. That is his wife, 3 children, mother-in-law, father-in-law, brother-in-law, sister-in-law, all asymptomatic, all in isolation at home. The hospital in Far Rockaway, St. John's Episcopal, have a situation there where 41 staff members, and this is again one of these abundance of caution situations, may have experienced exposure. They are all now in voluntary isolation, being monitored regularly, none symptomatic at this point. The hospital has been provided with support to have additional resources and personnel, and at this point reports normal operations. Cases 9 and 10, 2 women who went on a cruise to Egypt. So here's travel now coming back as a factor. 2 women from Brooklyn. They are 66 and 71 years old. No pre-existing conditions. Returned to New York City February 20, so that's now over 2 weeks ago. They were symptomatic. They did the right thing. They immediately isolated themselves at home. They are now asymptomatic and still at home. No close contacts who require follow-up. Those are cases again, 9 and 10. Case 11, 39-year-old man from Brooklyn who was in the affected area of Italy, came back March 2nd. Symptoms manifested March 3rd. In serious condition in a voluntary or private hospital in Manhattan. Does have pre-existing conditions. Serious condition now, as I said, one close contact business associate tested negative and is in isolation. Case 12, 58-year-old male returned from Chile. Apparently contracted coronavirus during a lunch with a confirmed coronavirus patient in Chile. Lives in Manhattan. I need a reality check because I don't have this much fine-tuning. Hypertension, Dr. Barbot, is a group of pre-existing conditions or not? Okay, so does not have one of the pre-existing conditions. Was in a hospital in Manhattan, has been discharged, doing well, now at home. No close contacts to follow up. So that's the cases to date. We'll get you more on the Bronx case later. Just some other follow-up from ones we've reported earlier. The Westchester family, all doing well now. And then the employees at the law firm, Lewis and Garbuz. 4 New York City resident coworkers, all negative, as we've said before. 4 non-New York City coworkers. We have 1 Westchester coworker negative, 1 New Jersey coworker positive, 2 remaining coworkers, 1 from Westchester, 1 from Nassau, both asymptomatic. And then another piece of news, because we had talked before about the healthcare worker from New Jersey who had seen patients in New York City, 32-year-old male. Specific information we want to give you now. He saw 11 patients while symptomatic, but he did wear a mask and gloves during that, which is important, and lessened the chance of transmission. 11 patients. All 11 are asymptomatic now. It's been a week. That's a good sign. And they have all been carefully monitored and will continue to be. We are working with the state health department on this right now, and we believe we have a low-risk situation. But it is important to confirm that this occurred at a nursing home, specifically in Brooklyn at 2266 Cropsey Avenue, the King David Center for Nursing and Rehabilitation. The healthcare worker from New Jersey also attended a small medical conference at the Westin Hotel in MIDTOWN. Based on the follow-up of our disease detectives, the attendees are all asymptomatic. Also, his family is asymptomatic. A couple more points, and then I'll turn to my colleagues. We reported a man in his 40s who was a smoker and vapor. He was hospitalized. He has been discharged. Now at home, mild symptoms. Has a partner. The partner is under mandatory isolation, is asymptomatic, is the only contact of interest to our disease detectives. The last of the previous cases, this is the one we're most worried about right now. This is the woman in her 80s. It's not going to come as a surprise to anyone. We're really concerned for her. She is hospitalized and continues to be in very serious condition. So we are hoping and praying for her. There was a report in the media about an employee of The Gap. Best of our understanding, that report was erroneous, came up Friday. We have followed up with the company. The individual, to the best of our understanding, not from New York City and does not have coronavirus. So any company that is has concerns and wants to connect with the city to report information, or has rumors that are not accurate and wants to help us dispel them, please reach out. And there's a specific place to go online. The words public-private at oem.nyc.gov, public-private at oem.nyc.gov, and Deanne, let's make sure they called a 311 that gets routed as well. Finally, I'm going to say a few words in Spanish, and I want you to hear from three of my colleagues. Esperamos más transmisión entre comunidad de coronavirus. Estamos implementando medidas nuevas y más amplias para contener el contagio. Repetimos, si tienen algún síntoma, vaya al médico de una vez. With that, let me turn next to our health commissioner. I want to thank her and her extraordinary team at Department of Health. They've been working very, very hard these last days. Want her to give you an update. Dr. Barbot. And I want her to be taller. Okay, there we go. Do it again. Look at that smile. Okay, there, that's much better.
There you go.
You could be the spokesperson for elbow bumping.